Hi everybody, this is Dr. Lindell. This is a question that comes up a lot in my clinic, so I wanted to take a few minutes and just kind of address this question. And it's talking about cholesterol. So many times people come into my clinic and they're taking cholesterol medication, or they've seen another doctor that's not a functional medicine doctor like me, and they're taking a statin medication, something like simvastatin or Lipitor or Zocor or Crestor, because we've been told that we need to take cholesterol medication if our cholesterol is high. But what isn't, what a lot of times isn't understood, and is that the drug companies are of course pushing these drugs because they want to make sure and sell their prescription medications. But nobody's talking about, first of all, what sort of cholesterol do you have to worry about, and how can we actually lower cholesterol naturally without actually having to take a pill for a problem. And so I always talk to people about this little graphic, and it talks about what actually causes plaque formation in your arteries. So the very first thing that causes plaque formation is this thing called LDL cholesterol. But you can see here that there's actually two different types of LDL cholesterol. The first one are the big fluffy type, and this is a special cholesterol test that you have to get done from your doctor. It won't show up on a normal cholesterol test. So you have to differentiate, and you have to get what is called the large LDLs and the small LDL particles. So the big particles are big and fluffy. They're like beach balls. They bounce down the arteries. They don't cause any problems with plaque formation. And the little small particles, those are the ones that can stick into the side of the blood vessel wall and cause plaque formation. So when you get a standard cholesterol test from your doctor, they'll never look and see if you're making mostly the big fluffies or the small ones that can cause plaque formation. But this is a test that I definitely do in my clinic so that we can differentiate between the two different types of cholesterol, the beach balls or the golf balls. But the interesting thing is, when you take statin medications, it'll lower your LDL cholesterol, but it's going to lower the big fluffy ones that aren't a problem. It doesn't touch or do anything to the small LDL particles, and those are the ones that are the most concerning. So why would you take a medication that isn't going to get rid of the cholesterol that's creating the problem? So that's one reason that I don't think it's a great idea to take a statin, because you're not really getting rid of the cholesterol that is beneficial. And then the other thing that causes plaque formation is inflammation in the blood vessel. So if you get inflammation throughout here, it makes your blood vessel wall sticky, like Velcro. And so what are the markers that we use to check inflammation? Well, there's a marker here called high sensitive CRP. There's another one called LPPLA2. And those are labs that I do on my patients in my clinic as well. Because if you have small particles and a sticky blood vessel wall, you're more likely to increase your risk of developing plaque formation, therefore leading to heart attack and stroke. And then the third reason that we could form plaque in our arteries is elevated blood pressure. So you can now imagine that if you have a small particle on a blood vessel wall that has become inflamed and sticky, going at a faster pace, it's going to stick and cause plaque formation in the arteries. So taking a statin lowers your LDL cholesterol, but it doesn't get rid of the small ones that create the problem. And so that's why I'm not a big fan of statin medications. And in addition to that, there are multiple side effects of taking statin medications. So one of the other big ones is that many people don't know this, but by taking a statin medication, it increases your risk of developing diabetes by 30%. And that's the very thing we're trying to avoid, is increasing our cholesterol and then developing diabetes. So that's another big reason that I don't recommend them. Another one is they've only been proven to help 1 in 400 people. I don't know why anyone would take a drug that has been proven to only help 1 in 400, that's men. And it's even worse in women. So taking a medication that would do that doesn't ever seem like a really good idea. Another good reason is it depletes something in your body called coenzyme Q10. CoQ10 is so important for function of energy. Inside your cells, you make energy in what are called the mitochondria, and the mitochondria need coenzyme Q10 to make ATP, and the mitochondria then become dysfunctional when people take a statin medication. That's why people get a lot of leg cramps, and they get brain fog, and they get problems with their liver, because it's affecting the mitochondria, which are a big deal. And lastly, your brain is 30% cholesterol. And frequently when I hear people starting on a cholesterol medication, that they start to experience brain fog and problems with their memory. And it's because it's damaging these little mitochondria that make energy for the brain cells, and then they can't work very good. So I don't ever recommend people take statin medications. It's never a good idea, because the outcome and the benefit, it's never been proven in any study to take a statin medication and decrease your risk of dying of a heart attack. And wouldn't that be the entire point? So what I do, I have about 3 things that I recommend to help people control those 3 big things that we talked about, like the LDL cholesterol. How do we get the small LDL particles down? Well, the first thing I do is I recommend a ketogenic diet, because going on a lower carbohydrate or lower sugar diet decreases your production of small LDL particles. So that's why I often recommend people eat low carb, moderate protein, and higher fat, because it's not fat that's clogging your arteries, it's sugar. And so staying off the sugar and eating good fats seems so paradoxical to what we've been taught, but it is the thing that will lower your cholesterol. And then secondly, to decrease inflammation. So I'm a big fan of a couple of nutritional supplements. One that I really love, this is a product I sell here in my clinic called CardioCore. But basically what it is it's berberine, and it's alpha lipoic acid. And this has been proven to lower blood sugars and to lower cholesterol naturally without the detrimental side effects that you get from taking a statin medication. Plus, there's a new study out on something called bergamot oil. So we have a product here called Healthy Cholesterol Support. And bergamot oil also has been almost to be as effective at lowering cholesterol as a statin medication. And again, without any of the side effects. And then lastly on here was, well, how do we control blood pressure without maybe having to take a blood pressure medication? Well, we sell a product here called Healthy Blood Pressure Support. And these are all the natural things that will help lower your blood pressure naturally without having to actually use a prescription medication. But I think always it starts with food. And the food plan that I recommend always for people to get their cholesterol under control, is a ketogenic diet. But don't take statins. Just to review, they don't lower your small LDL particles. They increase your risk of diabetes. They are only effective in 1 in 400 people, and that's men. They deplete your coenzyme Q10, which is one of your primary sources of energy, and they affect your brain adversely. So thanks for watching. If you'd like to learn more, I'd be happy to see you here in my clinic. This is a test that I offer here in my clinic, and we can see if we can get your cholesterol on track without taking a prescription medication. Thanks again. Bye.